I want to welcome you all into Coronavirus Inside the Arizona Numbers, where we take a much closer look at the data coming out of the state of Arizona to help you better understand how things look here and help you make the best choices for your family and your life. Of course, it is, I don't even know if I said the date, January 18th, 2021. And because of that, it is a holiday, Martin Luther King Day. And so there are going to be some irregularities in the holiday reporting, but we'll help you through that. We'll walk you through it and explain what some of these numbers mean. So we will start where we always do. But first, Garrett, I know people are going to ask, and look, Misty already is. How are you feeling? How is the first weekend after being COVID positive?
You know, I've been very fortunate. It hasn't hit me very hard at all.
Good.
I had the lack of sense of smell and a muted taste, and I was tired for a couple days, but pretty much that was the extent of it so far. So it's, you know, I've been very fortunate. So
yeah, you've been super lucky, especially when we look at these numbers. And I know you know how real all these numbers are and how difficult it is to see more than 11,000 Arizona families losing a loved one. So we're glad you're doing well. You're not confined to the room anymore, but you are working from home, so you're able to just kind of lay low and hopefully you have everything you need there. Okay, so let's start on that that data page, and we'll talk about. Let us know where there are any irregularities because of the holiday reporting, and then I know everybody wants to know about the vaccines, the big day tomorrow when we add all these people, and so we'll answer some of your questions about that too, because I know everybody at 9 tomorrow morning is going to be on their phones the whole time, on their computers, trying to get logged on. We'll go through it. So, all right, start where we always do, Garrett, with that data page.
This data page, as you just talked about, Katie, this is Martin Luther King Day, and Martin Luther King Day falls on a Monday, which means we've had 2 days where the the epidemiologists at the Arizona Department of Health Services were not working, essentially. So we have extremely low numbers today. 5,400 new cases and a withdrawal of 1 death, so -1 deaths today. That were on the case. And I know people see that data and they think, we've seen this before. This is not the first time that Arizona has posted a -1 as a report. And we have to go through this because people, you know, some people think that this is X amount of people died in a 24-hour period. And we get these -1 reports and it shows you that that's simply obviously not the case. It's a situation in which, you know, these epidemiologists are researching, continually looking at this data and trying to figure out when a person may have died. Instead, you know, it's not a 24-hour period. It could have happened, you know, 15, 20 days ago. And this is a situation in which no deaths have been reported to the Azdhs by the counties. But we're doing research, and at least 1 death certificate was, it was like, okay, this is not COVID-19. It was suspected COVID-19, and then it was removed from the data. So, or it could have been a duplicate as well. So we never know which one it is. But that's the reason why we see a -1 today. Pretty low testing day, 14,577. Again, you know, you presume that with being a holiday, that we wouldn't be seeing a lot of testing, at least not a lot of testing being processed by the labs. So this is what we're looking at right now. As far as where our 7-day averages fall with this, pretty much we're in a slowdown in all metrics right now. And of course, today being, again, a holiday, it's going to show low numbers, but pretty much the only metric we have that is still in the top 10 is the 7-day death average. So Arizona is still reporting about 159 deaths a day. I do expect that, unfortunately, to go up. And we'll see this just like we did in the July numbers. If right now we are looking at the finally going past the peak in our cases, which there are indications that we are past the peak and that we are going to start declining now, we still have at least a week or so of fairly high death numbers that are going to be coming through. It's always the last one, obviously, to fall. It's the last one.
Yeah.
We've got enough it's like bad numbers essentially, but all the other numbers are starting to fall pretty quickly.
I so want to hold out hope in this, and I know that there's been a couple days of a dip. We did see a couple days of a dip in Arizona in December, and then it picked right back up. How many days are you seeing it lower? Just for reference, is it like 2 or 3 days? Has it been a week sustained, or?
I have right now, let me just look really quick. I have 5 consecutive reports. 1, 2, 3, 5 consecutive reports right now in which the numbers from the Azdhs has been week over week in a decline. It started at about -3%, and then it went to -11%, then a 5%, and then today it's at 30%. But again, because today's a holiday, I don't put a lot of stock in that particular number, because tomorrow should be a fairly high number. That does
Yeah.
not mean, even if we do have a fairly high number tomorrow, somewhere in the 10,000 plus, that because we've had 2 days of really low reporting. That doesn't necessarily mean that we're back on the increase. It's
Hmm.
going to be filling out a lot more data tomorrow, so we could still be. I still think we are on the decline, and I think we have been since the report on the 14th to the 15th,
Well,
so
that
about 3 or 4 days ago.
I mean, that would be good news if that holds true. We certainly hope so. Carrie had posted in the comments. She writes, "Isn't it?" Oh, it just rolled by. Isn't it sad that 5,400 seems like a low number? Isn't it odd that we now think 5,400 is a low number? She writes. Exactly. We saw so many high days, and I think of that often, Carrie. Actually, I think back to last summer and some of the reporting that we were doing when we just started doing this with all of you, and it's such a shock now to think back at the numbers that we're seeing that are so high. In fact, I posted about that on my Facebook page yesterday because, Garrett, 1 year ago last night is the first time on the air here in Phoenix I talked about a mystery illness that we were seeing overseas. Didn't even have a name for it yet, but in that early reporting, it's wild that it's been a year since that time, and how much has happened since then.
Yeah, it is absolutely. It's been a very surreal experience, and
Yeah,
will continue for a while longer.
yeah,
As far as the reporting of these numbers,
yeah.
eventually the vaccines will kick in, and we'll start to get to the point where these numbers are dropping significantly. But
Okay, so
we're still a while. We're still a while from that.
for sure. Okay, so as we explain all the time, first we're going to see case numbers hopefully drop, and then we would see a dip in hospitalizations, and then
We are seeing
finally, and
yeah,
we're seeing
and
that. That was my next
as
question.
well. So yeah, we are seeing dips in both cases
Hmm.
and hospitalizations right now. So there is indications that our ICU numbers are they're artificially dipping, unfortunately, because it does appear that the death from ICU, the case fatality rate in ICU does appear to be higher than it was maybe like say a month ago.
Right.
So like for example, we're seeing lower ICU numbers but higher ventilator numbers. And that just says that, while we're seeing these discharges, these ICU numbers going down, it's more because people are dying in the ICU rather than people are getting better in the ICU.
Yeah.
So that's obviously sort of a sad data point. However, at some point, I said we're already seeing inpatient numbers, and we'll go over them right now. We'll go over them in a few minutes. We're seeing the inpatient numbers go down, and then we're seeing ICU numbers go down, but they're going down a little slower. And then, like I said, the deaths should come next. So,
Hmm. All right. Okay. So, do you want to go through the hospitalization numbers now?
yeah, let's just go right through them. I'll go back to the AZDHS so we can talk about them there. It's just since it's the easiest way for people to access them, I'd like to keep it, using
Hmm.
those data points. So, and this is what we're talking about. So this is inpatient, the general acute care. You can see we reached a peak on about 5,082 on January 11th. We are down to 4,752. We've had several days of decline since that time, and in the inpatient numbers. The ventilator use, well, let me go to ICU first before we go to ventilator. ICU, we've also seen a decrease right now from 1183 to 1,097. So about 100 ICU beds being freed from COVID-19. But this is what I was talking about. You can see we're just recently just going down from ventilator use in the ICU. We were hitting records only 2 days ago, and we've only gone down for a couple days now, which indicates to me that we were seeing very high deaths in the ICU. And we can see that also in the discharges. We were seeing very high discharge numbers as well. And as we've talked about before, we haven't talked about it in a while, but we've talked about it before, discharges are not just people being released from the hospital. The discharge is simply the release of a bed. So that could also be someone dying in a bed.
Hmm.
So we just have to understand that is a situation with COVID-19, is that the discharge is not always someone who's getting better. And we did see very high intubation numbers as well, which also led me to believe that the death rate in the ICUs is much higher than it used to be. We have had 2 days where the intubations have just dropped like a rock. And that's probably, in my opinion, one of the best data points to look at right now. I'm hoping that that's not a reporting metric or a artifact, and there's an issue there, because really keeping up with the high intubation number, that means that the ICUs with COVID-19 are still a massive problem. And as the intubation number goes down, so should the fatality numbers in the ICU.
Okay, so a couple things to keep in mind there. That is pretty much in real time, Garrett, or does that have any delays because of the holidays? I know we have a lot of people joining us who aren't always on here, so I want to make sure they understand our hospitalization numbers.
So I see Amelie Grimes is asking, why would death be counted as discharges? And I understand the frustration there in the use of the word, Emily, and because you think a discharge is just someone being released and being recovered. And that is absolutely something that I understand the frustration with. I think this is more of a medical term that we in the non-medical community aren't used to seeing being used the way that they use it. And simply in medical terminology, a discharge is the release of a bed. It just means that the bed is now free. And you know, we see that and we think discharge, someone is being released from the hospital because they're on the recovery. So I totally get your point. But that's just the way that the numbers are being reported.
Yeah.
In the data.
A lot of people think of discharge as the front desk paperwork that's being done when you're released, and that's not the case. That's
I totally understand the frustration.
Yeah.
Like, I get the caps on this one, because it was frustrating early on, because it took me a while to figure that out as well. So
Okay, so let's see. I want to make time for all the things, and I know since we weren't here with you guys on Friday, I want to make sure that we get to everything. So if there's anything else you want to highlight there, I want to move on to the vaccination numbers and a little more information about tomorrow's process.
Sure. I will just really quick show one last thing on these when I'm talking about hospitalizations. I'll start here. You can see that while we are seeing lower numbers and we saw this initially too, during the first surge, you can see that the hospitals are quickly replacing these beds with non-COVID-19 patients. So they're obviously in a situation where once a bed was released from COVID-19, they have such a load right now that there's someone to immediately take that bed over. I know we are in the midst of flu season, and we're in the midst of sort of, you know, the winter is always sort of when hospitalizations are at a higher number, but that's just something to see. Our census numbers are not going down, so they are pretty much staying, staying in this 92, 93%. We can see that in the ICU as well. The one numbers we are starting to see dip, which I find to be very hopeful, is the emergency department beds in use. We're starting to see a slight dip in these numbers as well, which means they're not having any holdovers in the emergency room departments. So there are some, I mean, like I said, for the hospitalizations, for all of this, there are some good numbers here, some really encouraging numbers that are showing us that we might be coming to the sort of to the fall of this surge, the decline of this surge. But again, we've got a couple more, like maybe a week or so more of pretty high death numbers before we start really seeing, start to be able to take our foot off the gas, if you will.
Yeah. Okay. So let's talk about the vaccines. And I see some people already posting. Let's see. AG is posting. I'll receive my booster tomorrow. I feel great. No side effects except for the obvious pain of having fluid filling the space between your muscle fibers. That's the biggest thing that we've heard so far. So AG is going to be part of that 32,000. We'll have 32,000 with a complete series here in Arizona of their vaccinations. Total vaccinations given out to Arizonans at this point, 281,000. Obviously, we still have a long way to go. But okay, here's the information, Vicki. So much information to give. If you're 65 plus, tomorrow is the day you can start signing up at 9 in the morning. It's going to be very, very busy. I can tell you this. This is for the 2 state-run sites. So that's State Farm Stadium and also the Phoenix Muni site that's about to open tomorrow as well. So 65 plus, we're talking 750,000 Arizonans that are in that group that are able to start signing up at 9 tomorrow morning. The site for you is pod. Oh, I'm going to have to look it up. Pod.vaccine. Garrett, do you remember? Oh, here it is. Podvaccine.azdhs.gov. Thought I had it memorized. I took 2 days off and, just have a weekend and the website leaves you. So that's the place to sign up. There are some, weird things about whether you have a desktop computer or an iPhone or an Android. So make sure you find that on the front page when you're signing up there. It's got a little more information. So if you're not getting through, you might have one of those devices that's not yet compatible with the system. So these 750,000 Arizonans that are going to be able to sign up, you're part of Priority 1B. It was supposed to be 75 and older. They changed the rules. They're adding the 65 plus in, and people are saying, okay, these two sites, they're too jam-packed. I can't get over there. Why isn't my doctor's office giving this out? Why aren't pharmacies giving this out? Part of the reason is, remember, it's got to be kept at that negative temperature that doctor's offices just don't have that capability. There are other vaccines in the works. We are getting closer to the Johnson & Johnson vaccine. That one and some of the others are going to be able to be distributed in other ways. Also with this, we've got 100 pharmacies here in Arizona that are going to be up and going in the next few weeks. They have 800 total pharmacies. So if you are at home, you are safe at home, and you can wait it out, and you want to wait it out to just be able to go to the vaccine because trying to get over to State Farm Stadium or Phoenix Muni is too difficult for you, there are going to be a ton of pharmacies that have this very soon. The biggest limiting factor, okay, in signing up all together is the amount of doses that we have. The shipments are coming in each week, but isn't it interesting, Garrett, how we had, you know, whether it was the testing agent before or it was the testing site. I mean, each point in this pandemic, we have walked you through, you know, whatever it was that that wasn't ready to go or that part wasn't working. And in this case right now, it's not enough vaccines. So that's going to be the issue. Can you call to sign up? Katya, yes, you can. Dial 211. There's a longer number, but yep, Karen's already answering. Karen, thank you. 211 is just the easiest way to go. Remember, after 9 a.m., that's when that Phoenix Municipal Stadium is going to open for sign up. And then that's when State Farm Stadium signs up for February. So if you are going to go tomorrow and sign up and you think, oh, like, let me look at this day in January if this is going to be good, you're not even going to be considered for January. They're not even opening those dates until February. The one thing that I can say, and the one thing that the email that I'm getting from so many people is, well, I don't really want to go at 2:30 in the morning. If you get 2:30 in the morning, if you're safely able to get there, I would just take it because these are filling up so fast. So I'm hearing from people who want to go, want to turn down the 2:30. It's like, you know, can't be choosy in this point. If you can get there and you want to get this done, I would take it even at an odd hour as long as it is safe for you and the person taking you over there. So lots of information to get to. I'm seeing lots of questions. Garrett, were you seeing some of them? I want to get through to everybody.
Yeah, it said, let's see, I was looking to see if there was anything else. Someone wanted the phone number and web address again.
Yep, I think Carrie's got it up on the screen for us.
She does. Okay, thank you. No, I don't see anything else. Sorry.
So if you have any questions, post them in there. Otherwise, we will help get you more information on there. There's a lot of questions answered on both the county site and the state site. Remember, this sign up, the big push tomorrow, you're going to want to, these are for the state-run sites. So that's State Farm Stadium and Phoenix Municipal Stadium. So there's one East Valley and one West Valley, and that's it. That's the other complaint I'm getting. People are saying, but I live in the far East Valley. You know, that one's too far away. I'm so sorry. Those are the only two open at this point. Remember, if that is a limiting factor for you, then just wait for the 100 pharmacies that are going to be open. That is in the next few weeks. So I know it's a lot of information to come out on all of this, but wanted to get you updated.
This might be a question for you. I don't know the answer, but Rita's asking about appointments for people who are looking for their boosters. And I thought there was a pretty, when you're getting a booster, it's a different situation because you have to get your booster.
Yes. Okay. So they are saying that they will email you. So hopefully they have, if not, call that 211 number, but they are supposed to be emailing everyone. The email address that you gave when you signed up is the one that they're going to send it to. Check the, what do you call it? Junk mail to make sure that it's not in there, and then call 211 if there's no information that comes for you, because that is their prime way to get in touch with you is through that email address. Okay. We do know which it is. Pfizer. So I'm assuming that's the same one at Muni, but I don't know for certain.
I'm pretty sure almost every vaccine in Maricopa County is Pfizer.
Okay.
Yeah, because that's and the Modernas are going to the rural counties. So at least that's what it was. I don't know if the ordering is now being mishmashed, but that was what it was initially.
Yeah, and AG is also saying I received a text message for my booster reminder too. So great that they're communicating that way too. Candace writes, "Beggars can't be choosers. I can't believe people want to be picky." I know, Candace. I thought the same exact thing, and I had to give myself space for a minute and go. There's got to be some other reason they can't get out there, or they don't have the drive, somebody to drive them or something. But that's exactly why I wanted to stress that that if there's any way you can get out there to that time, I would try to go, because that's exactly, Candace, what was happening. People would email me about it, and then I'd be like, oh no, and they're probably not going to get another one. So it's very hard to get these appointments. It's very hard to get through on the phone. Everybody's been emailing me. Literally, when I'm not in a newscast or I'm not here doing this with you, I feel like all I'm doing is replying to people on Facebook and returning emails about the questions. Okay, 1B congregate care. If they are over 65, if they are not over 65, they cannot sign up tomorrow. They're going to be kicked out of that. So over 65, if you're under 65, just an adult living in congregate care, you're still in the next group. I think it's either full 1B or 1C, and that's on their webpage. All right. We'll see. Candace, thank you. Okay, so we'll come back to questions on vaccines too if we have any more. Just refer to that AZDHS site, because they have a lot. They have a whole Q&A section, and also the county health department has a whole Q&A section. If we didn't get to some of them here, I can reply to you guys later, and I'll get you in the realm of the return emails and everything too. Okay, let's see. One more thing of good news. The Suns are playing tonight. We had to bump back a bunch of games. We always update you on the sports things. Games were canceled all last weekend. They do plan to play tonight. There was some concern. They have a couple players on the health and safety protocol, which likely means COVID, but they don't necessarily say that. I think there's like 3 players on the health and safety protocol. So, and no football to talk about here anymore, sadly. But good season, Cardinals. Okay. Not that good. Good, not that good. Okay. Let's talk schools briefly, because everybody seems to be, a lot of schools are going back tomorrow for in-person, and also
move to, well, I guess, should we, I was going to talk about the age stuff, but do we
yeah,
want to talk about schools first and then
go for it. No, do the age stuff. We got a couple things to get through. So
yeah, so let's just go through the age thing really quick before we go to schools, because school typically leads to that the zip code the zip code. So I would just want to go through this really quick. This is the story that Nicole Grigg did. Let's see if I can just pull it up. Here it is. Sorry. There it is. I was waiting for it to show up. So this is from Banner. This is data directly from Banner. Their COVID-19 pediatric hospitalizations for January projected nearly 6 times higher than October. So you can see, using their internal numbers, they had only 77 pediatric hospitalizations in October 20th, or excuse me, October 2020, and now they have 396. So there's a lot more pediatric hospitalizations going on. And the data that we have, just looking at their own the AZDHS data, sort of bears this out as well. So when you look at sort of what we've seen since November 20th, we've seen about 157% increases in the hospitalizations for the 0 to 19 category, which is high. It's the second highest. It's not as high as the 65 plus, which is unfortunate, because that's obviously the highest risk category. And we've seen it just, when you look at really the change from the very beginning, and just because obviously there's been very few hospitalizations for the younger demographic, especially early on, it's a 7,000% change since May, is where we are right now. That's how pretty crazy it is out there. But again, we are seeing it starting to dip. So since 1220, we're seeing about 100% change. So it's about double since 1220 for that age group. And then for the 65 plus, it's about 121%. So what does this mean for that demographic before we move on to the schools? So the hospital rate for kids who get COVID-19, or at least confirmed test. Now again, obviously there's going to be a lot of people in that 0 to 19 category that did not get a test, may have gotten COVID, but just never got a test. But especially for the younger groups, like the 0 to 5s, if you will. And the hospital rate, though, for confirmed cases for that group is 1.2%. So 1% of cases from 0 to 19 end up in the hospital. The the case fatality rate, let me start with case fatality rate. The case fatality rate for that age group is 200th of a point. So it's only 19 right now. And of course, when we're talking about deaths, and you obviously every death is very important. So we don't want to downplay any of these deaths, especially in that age group. But it's only 200th of a point. However, the hospital fatality rate, so the kids, as these numbers are growing, the hospital fatality rate for that group is about 1.5% as well. So if you're, and what the way that logic string works is, if you have a confirmed case, about a 1% chance that you go to the hospital if you're that age group, and then about a 1% chance from there of those that went to the hospital that there is a fatality in that group. So very low numbers for that group, and that's contrasted with, say, 65 plus. And this is when I talk about, when everyone puts on the comment section 99.9%. This is sort of the foil to that, because about 24% of 65 plus cases will go to the hospital. Of those cases, of that 24%, 40% of them are going to end up in a fatality. So the case fatality rate for 65 plus is 10%, which means that if there's a confirmed case of that group, there is a 10% chance it ends up in a fatality. So that is not 99.99%, obviously. And that's one of the reasons why we have to look at this when people talk about that 99.9% recovery rate. You have to understand that when you start breaking it up by age group, that 99.9 drops very quickly the older you get.
Yeah, that's one of the things that we, for a bit had to wait some time for more numbers to come in so that we could crunch those numbers. Early in this pandemic, even looking at CFR or case fatality rate was concerning because the numbers just we didn't have enough information in to make sense of this.
We weren't testing enough either. Only people who are going to the hospital were getting tested. So our case fatality rates were extremely high.
Right.
Because you were already basically in that hospital fatality rate category, because you were being tested in the hospital. Now we have community testing. We've had it since about mid-July, mid-August. And so now because of that, we have more sort of an accurate representation of what these case fatality rate and hospital fatality rates are.
So I just want to stress that once again, 23% of that 65 plus age group who comes down with COVID ends up hospitalized.
Yes. And then of those 24%, a little less than half are going to end up in a fatality.
It's just incredible. And overall, when we're just looking at Maricopa County, and overall, we're seeing about 7% end up hospitalized. So that's a big difference between 7% and 23%.
Well, yeah, because when you're looking at 7%, that's everybody, including the 19 with their 1% hospitalization rate. So when you start to obviously go up the age chain, that 7% goes to 20% very quickly.
Yeah, when you go from 7 million down to 750,000, or that's 65 to 75.
Way more high risk.
Yeah. Oh, Joanne's asking, and I can answer this really quick. Can you schedule 2 folks at once at the AZDHS site? Yes, you can. Once you click through, it should say household, but I think you have to have 2 separate emails. So know that before you go sign up. I believe it's kind of everybody in the car, everybody in the household that you're going to head over there. Let's see. Okay, I want to get through all this other stuff that we have to get through. So the schools opening tomorrow. When we see this age group and this new reporting coming from Nicole Grigg, and 6 times the rate of hospitalization for our kids, and the big thing we want to stress in this is these new numbers, they all come from Banner, so it's not everybody in the state, but it does break down the group separately than what we have seen from the county. So the county, the best way it was divided, or for the state through that matter, was 20 and under. But this Banner group, they're giving us more information. They're saying this is a true group of minors. It's 18 and under.
Yes.
Okay, so her reporting's coming up this evening. You can check it out there. You can also, if you want to get like a little primer on what we just talked about, you can find that over on the front page of abc15.com. It's got that right there on the front page when you log in. So it's just one of the concerns as parents are deciding whether their kids go back to school tomorrow or they stay in remote learning. Also over on our website, you can find that information on schools and their plans at abc15.com/schools. We've got a breakdown of the schools and their plans and their closures on there. Let's see, Garrett, did you have any other information on the schools tomorrow that you wanted to touch on before we move on to the next thing?
Well, no, I was going to go to the school map whenever you're ready.
Yeah, so. Perfect. Go for it.
that's where we're going to go. So we didn't talk. We didn't do a lot of this work. Yes, last week. I've been sort of waiting on the school map for a couple weeks now because the school map is always about 2 weeks behind what's
Mhm.
going on in reality. It looked really good for a couple weeks because it was set in the late December timeframe where cases were going down. So now the data is up to the 9th, July 9th. So it's now sort of impacted. It's now basically what's going. Did I say January?
You said July.
Sorry.
January
January
9th?
9th.
Is that what you mean?
It's a
Yeah.
January 9th now, so that obviously now reflects the higher numbers that we've seen since Christmas.
Okay.
So we can now look at this data and have a better idea of what's actually going on. So I'm going to start with my let me just start with my map. It's just a little easier to see. Let me see if I can get this up really quick. So,
That's fine. That's fine. As you're pulling it up, I'll just mention we'll hopefully here in this chat get to some of the forecasting for the future, so we can kind of walk you through where the modelers are thinking that things are going to go for the next month or two, and how the vaccines play into that. We'll try to make some time for that. So I just wanted to let you know, some of you in the comments will have that coming up. Go ahead, Garrett.
Okay, so I'm just confirming that I have the right data here. I do. Okay, so I'm going to pull up my map because it colors it a little different. Because the GIS map, Maricopa County, which is extremely useful, but it's all red at this time. So it doesn't. It's no help at least seeing what's going on region to region. So you can see this is what the newest map looks like. Obviously, the darker color means the situation is much worse there. You can see we have several districts that are in black at this point. Queen Creek Unified School District is at 1237. It's the second highest number. That's the per capita number, 1,237, with the positive percent of positive at 24%. Extremely high numbers. It almost went up by half from the week prior. You can see we also have in Palo Verde showing a 1240. That's the highest of all the elementary school districts. So you've got a lot of stuff out here in the rural. You have Avondale right here with a very high number, and again, high numbers all around. There was a couple minutes where it almost looked like things were going down here and there in the East Valley, but the East Valley is definitely crawling back up very quickly. So it was back. This is the community spread we were talking about when with post holiday spread. It's gone out everywhere now. All of these numbers are higher. So that being said, let me stop sharing this. Now I'm going to go to the GIS window itself.
And so, Garrett, that's a map that you put together, the color coded there, that helps people sort of get a better overview of how things look across the city.
Yeah, and that's because when I share this map, and everyone's very familiar with this map.
Yeah.
What are you you see this map, and what does this mean, right?
Right. I see red. That's all I see.
We're all in red. It's just like, okay, great, we're in red.
Right.
That doesn't tell me anything. We've been in red for weeks now, probably more than a month. So I put that other map together just to give us a little better idea of what's actually going on, since everyone's in the red. So, and this is what we were talking about. Queen Creek, as I said, is the second highest, but we have growth in 90% of the districts at this point. In fact, it's going to be essentially all the urban districts. Any place we don't have growth, it'll probably be in a rural district somewhere. But just high numbers all around. When we go to the high school districts, we can see again growth. Tempe, this is Tempe. This is 461 to 688 in Tempe. Phoenix Union went from 572 to 850, and then one last big one. 611 to 945 in Tolleson. And so when we look at the zip codes, again, we talk about this, it's completely red. So, and 90% of these also went up. So this is just where we are here. It's just, there's community spread everywhere right now.
Yeah, and your map
85207. So it went up by 513 to 665.
I mean, this is wild to see these kinds of numbers. 600 per 100,000 people.
Mm-hmm. Yeah. Let me do the zip code map using my color scheme, just because that's going to be a little easier to see as well.
Yeah, it gives us a little more information. You see why that helps so much.
The red is just, there's too much red, and it doesn't mean anything.
I'm surprised they didn't add more colors after the map got to this point. That would help people decipher this better. So thank you for doing it on your own, Garrett.
Yeah, absolutely. Let me zoom this out. Okay, here we go. it was being kind of a sometimes these things. Okay, let's go to it. So this is the zip code map. Again, same thing as the school districts. It's just much smaller, more granular, sizes. So we can see right here. Here's Maricopa County. Here's the East Valley. And we said again, high number. The highest number here is in the 1500s. It's the Salt River Indian Reservation. At this is 536 to 1400. So basically more than doubled. It almost tripled at the tribal reservation. And then we have high numbers everywhere, for the most part. We have higher numbers in Queen Creek. We have higher numbers in this other one right above Queen Creek. We have pretty much higher numbers all over the East Valley, near double in most of these districts. We have some lower numbers out here in the Northeast Valley. I don't want to say they're lower, but they're just not growing as much in the Northeast Valley. And we do, in fact, in these rural districts have actually lower numbers in these very rural areas. But again, not very many people live out here. And then we also have, again, growing numbers in the South. So again, we're in a situation where it seems like the Southeast Valley and the Southwest Valley are really where things are really growing. And then sort of this area is where they're not. Now, there's something interesting. If people know the demographics of Maricopa County, you'll know that the wealthiest areas in Maricopa County are right here in this circle, right there. So it seems that a lot of these very high wealth zip codes, they're starting to have either lower per capita numbers or they're starting to shrink, whereas some of the more middle class and lower middle class sort of areas of the valley are getting hit much harder.
Interesting. I wonder if that's mirrored across the country as well, or if it's only something we're seeing right here. There are ways to look at that. It would take a lot longer than we have in this chat here, but if anybody's curious about it, let me think. On Johns Hopkins, isn't Johns Hopkins is the one that you can click through and you can actually see
a lot of that granular data.
Tons of information. If you were interested in looking a little closer at that, that would be the place that I would send everybody. But
it's actually in places like Ohio and Missouri and some of these Midwestern states where the counties are much smaller, you can actually use counties as a proxy for zip codes in some of those counties, because they have, unlike places like in the West, both here and in Los Angeles and these areas, our counties are so large that they're not of any use for doing any sort of demographic calculations. But when you look at the Midwest, you can actually look at, there's going to be counties that are right next to each other that all make up one large city, and there'll be one county that has sort of the same income. It's a much higher wealth county than the county next to it, and you can and that's the kind of stuff you can get from the Johns Hopkins. You can look at this data and see what their COVID-19 transmission is per county, and then see what those income and those other ethnic and demographic, any census demographics really are the makeup as of that county.
And it's important because it's a look at whether things are being treated equally, if there's enough vaccination sites there, if one group or another is being forgotten in all of this, or that the messaging is not getting through it. It's an important part of public health as well in all of that. Okay, so a few other things we just want to get to before we run out of time. Then, Garrett, are we still the worst in the world? I mean Arizona specifically, not just the U.S.
Sure, we are still the worst right now. Although we have declining cases. There's no question about that. But we are still the worst. Let's look at 91DVOC. It does one of the best jobs at visualizing this data. And I'm going to start here with the newly confirmed COVID-19 cases normalized by population via the all the nations, jurisdictions. And you can see that Ireland was at the top here. That's why I have Ireland highlighted. But now you have it at 4th. This is the B117 strand. They had a massive skyrocket, and then you can see they have a pretty big downfall as well. When we add a U.S. state, we can add Arizona, and you can see there was a time when we were sort of, we were competing with Ireland for the top spot, but they've dropped faster than we have. And while we have declining cases, we still are at the top. And the reason we look at these, this is the state graphs, and we can see we're at the top, followed by California. But we're higher than both California and Israel, Portugal, and everywhere else. So we are still the highest.
Oh gosh. So Charlene's asking, how are we worse than California? So we're worse than California when you figure in by population. So he's normalizing that chart for
Correct.
population. So basically, I forget how many are in California. I often use Florida for an example because Florida is exactly 3 times the population of Arizona. So if we have 7 million, they have 21 million. If you see a number of case count number coming out of Florida, divide it by 3, and then you know if we're worse than them or better in this particular case. So in the sense of California, are they in like 3rd place right now for the
they're right below
second?
us per capita. Yeah. California's second in the world. So it's
Yeah.
really it's a West Coast of the United States thing right now. And so I've got the top 10 states here that you can look at. So this is Arizona, California, South Carolina, Rhode Island, Oklahoma, Utah, Georgia, New York, and Massachusetts. Very interesting swath of states if you think about it. It really is representative essentially everywhere. I think there's one state from every region in the United States in that top 10 list, which really just goes to show how this is a community spread situation. It is everywhere, and it's not isolated to 1 or 2 states because essentially there's one state in each region that is being hit hard, at least one state.
Yeah.
So yes, but California is the second highest. Now, if we look at these, say like one of the things that is a problem with Arizona is, well, it looks like we're finally, let me go to this one. No, I'll stay with this one. I'm gonna highlight Arizona again. I'm gonna look at new deaths 1 week average. You can see we were the top. We're now the second. Alabama there's more new deaths being reported in Alabama than Arizona right now on a 7-day average. And so that's just one more metric. We were top yesterday, so that's okay.
Yeah.
And then the other one wins. Oh, you know what? We're actually running a little long on time. I wanted to get to University of Washington, so let's.
I know. I'm wondering if we should just save it for tomorrow because there's so much there that are actually for Wednesday. That's the day that we're back. I do want to answer a few questions. Victoria writes, should that mean that AZ gets preferential vaccinations? It's kind of like we're the problem child. We're the ones that can't stay home. We're the ones that can't follow the rules. So I guess we're not gonna get any preferential vaccinations. We just got to start listening to the recommendations and being safer out there, I guess. Let's see. There was one other question about the numbers on the Salt River Reservation. Do they have the highest cases for Maricopa County? I should ask it that way because those are only the numbers in there. Yes.
So Salt River, Pima. The 85256 zip code is the highest in the county right now.
Yeah. Okay. I know there were a couple questions, so I wanted to.
It's not the first time the Salt River Reservation has been the highest. It's typically, especially when we've been in a surge situation, like we were in July and here in early 2021. Salt River has frequently been on the top of the list at that time. They're not always on the top, but they're not a stranger to being on the top.
A couple more questions or answers, actually. Jackie writes that she went to check it out and found out that you only need 1 email account for all the family members. So thank you, Jackie, for that update. I know that was a concern for folks, so I wanted to make sure that we stress that. And then there was one more question about the variant. Let me see if I can find it here. Somebody had asked, do we have the variant here?
We do not have evidence of the new strain yet.
As of 3:46 p.m., 3:49 p.m.
Unless Banner, Sonora Quest, or ASU does another press conference in the next couple days and saying, oh, by the way, we found it. As of right now, we still don't have it.
So, Jeanette, not at this point, but Colorado does, California does, Mexico does. So we're kind of surrounded. It's kind of
probably do have it. Yeah. They haven't sequenced it. That's what it comes down to.
Yeah. Cindy takes the words right out of my mouth. So it's just a matter of time. Exactly. So please be safe out there. Please mask up. Let's see. We're just gonna have to wrap it there. We're gonna have to wait for the projections for tomorrow. And the RT, Andrea is asking 1 point.
You know what? Let's give this a couple days because the RT is going to go down and maybe even by under 1 in the next 2 or 3 days. So let's just wait for the RT because it'll be down below 1 soon.
Yeah, so watch it. The error bar is giant on that one. We are at the end of the list, 1.05. But as Garrett said, let those things all average out, and we'll take a closer look at it this week. All right. Okay. For those of you signing up tomorrow, first of all, Congratulations that you're getting to head over there and start signing up. Please pack your patience. I know it's going to be crazy. People trying to get in and call over to that 211 number or sign up on the website podvaccine.azdhs.gov. Just pack your patience. It could take you hours and hours to sign up. Remember, Phoenix Municipal Stadium is going to open up, so they'll be able to start booking those appointments early at 9 a.m. tomorrow. And then the State Farm Stadium appointments for February will start opening up tomorrow for 65 plus also. So good luck out there. Check back in with us. Let us know on Wednesday how things go if you get signed up. Hopefully, we're hoping that many of you are able to secure a time slot there and that you're able to get over there. Oh, Vicki, thank you. Take care, Garrett. She's writing because Garrett's still trying to recover from all of this. And glad you're feeling good enough to look at this, having this and still being able to keep us updated, because I know that this is important to you and helping us.
I'm very lucky right now.
Very, very lucky. And we're glad you can help us decipher some of these numbers. So, all right. We will see you back here on Wednesday. We are not with you tomorrow. We're on a special assignment for some other items. And I want to remind you that you can find all of our coronavirus reporting at abc15.com/coronavirus. I cannot believe it has been a year and a day now since we've been reporting on this, but it has. Garrett's Twitter account at Garrett_Archer is the best place to get his updates in the morning, an overview, a synopsis, if you will, especially since we won't be here with you tomorrow. And my Twitter account at Katie Ramel. You can also find me on Facebook. I'm seeing so many of the names in the comments that have now shown up over there, and I really appreciate that too, because we can often carry on the conversation there and get some of your questions answered. That's facebook.com/news from Katie. Jackie, thank you. You're so welcome. Thanks for saying so. And we will see you back here on Wednesday.